I'm Meredith Miller, licensed clinical marriage and family therapist with my scope of practice, able to do individual, family, and couple work. As a practitioner, I've been practicing and serving the community for 15 years. An area of focus that I have is serving individual adults who are experiencing depression or anxiety. The therapeutic framework that I like to utilize is really centered around cognitive behavioral work. From the very beginning of services, I want to make sure that clients feel that the setting is safe and that it's really a space for them to be able to talk about whatever's weighing heavily on their minds and hearts. Therapy has its own set of risks and benefits, and the benefit for therapy is that this is a safe, neutral, non-biased place to be able to, address some of those areas that are a struggle and identifying some things that will help work through those struggles. But the risks of therapy are really more associated in how I make sense of them is like if we were to do physical therapy and work on a muscle that was torn and needing to strengthen that, there might be sometimes that clients walk out of here and think that was exactly the relief that I needed. And other times they walk out of here and think, well, that didn't go so well, or that was, painful. And then as we are, processing that, we're really able to kind of, do some emotion coaching with it and having a better or deeper understanding of where those emotions are coming from and, kind of what they feel like and what are some helpful things that we can do so that kind of be able to work through those emotions, but not have them like flood us in a way that they are paralyzing us or incapacitating us. I think I always knew early on that I wanted to be in a role of helping to serve others and supporting others to create the life that they want to live and being able to, be a part of that. I really see it as an honorable role. The area that I draw a lot of inspiration from is actually seeing clients or being a part of clients' journey with, healing and growing and changing and maybe seeing the world in a new or different way. So the work of Brene Brown, I like to utilize some of her ideas and research in regards to living wholeheartedly and creating kind of like our authentic self. When we're faced with a difficult challenge and it really feels vulnerable or scary in a way of not knowing how we're going to get through it. And the answer to that, like what helps clients go through that process, is grace. Where grace, she had talked about, is the whisper that tells us that I can't make this less scary for you, but I can tell you that you've been here before and you worked through challenges before and that we can get through this together again. It's like one of those things where through your own personal experiences, your own personal challenges and struggles, that I have a very much deeper understanding of what compassion is when others are going through those same types of struggles. How I explain compassion and make sense of it is really that you and I don't have to go through the same exact experience for me to know what that emotion is like, what that feeling is like that you are, experiencing. Is that I have to go to my own depths of, like pain and sorrow and in order to, kind of draw from that and understand and help support clients that are working through that. Change is possible, and that it might take some time. It might feel scary. It might feel vulnerable. But that as you are going through the journey, that it helps, kind of to support us or motivate us in a way that we feel better about change. And then walking through the process, that we really kind of have a newer sense or renewed sense of kind of personal strength, or a renewed sense of our authentic self and living life differently.